You know, when Gonzalo and I launched the Race to Zero in June, we were joined by Dr. Maria Neira from the World Health Organization, and she reminded us that this is not just a race to zero emissions, it needs to be a race to zero premature deaths. I think she reminded us that every year 7 million people die prematurely because of pulmonary issues as a result of air pollution, many of them caused by the same things that cause climate change, like burning coal and running cars. So it seems like this issue of mobility is really at the heart of this nexus of climate and health. When we talk about the race to zero dialogues, we're really talking about what are the practical pathways to get to zero in each sector. And this one is a great example of what we call systems transformation, where everything is interconnected, you know, and often things seem simple when you don't have to deliver them. So I can simply say, all we have to do is end the sale and use of combustion engines. And I hope we'll hear some more about how that's going and what some of the challenges are. All we have to do is drive towards more active transport, more walking and cycling, the 15-minute city that we've been hearing about from some of the mayors. And all we've got to do is provide great public transport. So of course, each one of those three is really complex on their own. And if you're working in a city, or if you're in the value chain of any one of those, you've got to deliver all three together in an interconnected way. So I'm really looking forward to hearing from some of the great speakers about the progress that is being made, the challenges that we face, and the practical steps that need to be taken in the next 5 years in the reign of current mayors to make sure that we are on track by 2025 to get to fully decarbonized transport systems as soon as possible, so that we can ensure that the next generation who are so keen to get in on the act can go to cities, can live in cities and breathe the healthy air, and have the empowering abilities to travel around the cities that cities right now and cities of the citizens of the future deserve and are demanding. We all bring our personal experience, right, to these dialogues and these challenges. And so I worked in the automotive industry. So my personal obsession is the electrification piece, because it's the bit that I understand most. And then I listened to Rosamund so eloquently talking about the need to give people a sense of controlling their own community, and that's a totally different piece of the puzzle, which is exactly the kind of what we wanted to do with these dialogues, is expose ourselves to the different perspectives that can help blast away some of our blind spots, and also some lovely examples of that sort of deep engagement, whether it's the school streets or the different ways of engaging and making people feel that they're part of the solution, not just top down, although that is needed as well. I mean, Mark just talked about the massive investments that are needed. So thank you so much. So thank you also for lending us the last 10 minutes to try and wrap up the whole day. So Gonzalo and I are now going to just try and reflect on the whole day, which has been intense. It started with an adrenaline rush as the technology didn't quite work, with 10 minutes to go, 5 minutes to go, and we just launched on time. So I want to thank the World Health Organization, the Club of Rome, the Potsdam Institute, C40, and many other amazing partners. This really has been a radical collaboration. The whole day has got us off to a great start. Really inspiring. I mean, Gonzalo, we've had an incredible first day. Gonzalo and I have been trying to be listening to as many of the dialogues as possible. We started with a great opening with the Club of Rome and the Potsdam Institute, with Sandrine Dixon de Cleve and Johan Rockström, highlighting the importance of systems thinking, because we're dealing with systems transformation, and this panel has really highlighted that as well. That's at the heart of what we're trying to do in the role that we hold, Gonzalo and I. I joined a session with Climate Chant to hear about amazing work of colleagues in 45 African countries, working to build sectoral pathways that are regionally and nationally relevant. Some work for us to follow up on with the Marrakesh Partnership. Throughout today, the global health community has come together to take stock of health and climate crisis, this nexus, and again, nowhere more evocative than this issue of clean air, the air that our children are breathing. And Rosamund, thank you for helping try and get us down from the abstract of 7 million premature deaths to the image of children walking past gridlock. We've had, I think, a real emphasis on the importance of a healthy, equitable recovery. And Mark shared some still shocking numbers about how little of the recovery money is going towards the transition so far. Let's hope that changes in the next 12 months. We've had NHS England, the largest single health system in the world, committed to reach net zero emissions by 2040. That's not new today, but that's very impressive. And actually consistently throughout the day we've heard people saying 2050 is the minimum acceptable level of ambition. If it can be 2045 or 2040 or 2035, we've got to do it. That's the largest employer in Europe, and they're responsible for about 4 or 5% of England's carbon footprint. And today, Nick Watts, the Chief Sustainability Officer at NHS England, gave a detailed roadmap on how they plan to become the first net zero national health system. And I know they're calling on health systems around the world to join them. And just to prove how much climate action has been accelerating this year, this afternoon, Rishi Sunak, the Chancellor in the UK, announced that the UK is intending to make climate disclosure mandatory for UK-based firms. That's based on the proposals that those of you who work in the finance sector will be familiar with, the task force on climate-related financial disclosures, as early as 2025. And we know that the sunshine treatment, as those who work in the disclosure game call it, just like data. If you have data on air in your streets, you can do something about it. If you have no data, you're blind. Same thing if investors have data on the companies they're investing in. So that's a big step. But Gonzalo, how about you? I mean, I had hoped that you were going to be with us here in the UK, but now that we're on lockdown, and I know you've been up since about 5 o'clock in the morning, so we're just going to try something that's never been done before. Gonzalo, I think you must be really, really hungry. So I just wanted to just see if I can hand you a banana just to give you some sustenance to keep you going for the rest of the day.
Thank you so much. Yeah. Well, I'm gonna eat it later. So far, I'm still healthy. The only casualty I have to say is that I forgot to wear my jacket. So when you appeared, I just remember that. So sorry for that. But it's really great to be here with you, my friend, in order to close this first day of the Race to Zero Dialogues. It has been a really fantastic day. Today, we were thrilled to announce that the Healthcare Climate Challenge from Healthcare Without Harm has become the Race to Zero healthcare partner to mobilize hospitals and health systems around the world to join the Race to Zero. That's the type of announcement, the type of things that we want to listen during these 2 weeks. They have gathered hundreds of commitments by hospitals and health centers to transition to 100% renewable electricity and become climate resilient. We've heard also from cities that they are also being mobilized massively to join the Race to Zero. Today, C40 cities, CDP, and the Global Covenant of Major announced a new partnership to mobilize 1,000 cities around the world to join the Race to Zero in time for COP26, the 2021 UNFCCC Conference of the Parties, and in collaboration with the Science Based Targets for Cities partners. We also saw today the launch of a new Pathfinder initiative led by researchers at the London School of Hygiene and Tropical Medicine with scientific oversight from the Lancet Pathfinder Commission. They're going to map healthy climate solutions, aiming to increase motivation and capacity by showing how the implementation of well-designed policies and technologies can yield multiple benefits for people and the planet. I'll hand it back to you while I enjoy my banana.
Wow, Gonzalo, I can't believe this is only day one. This really, there's a real strong sense of this momentum around the health and climate nexus building. It's been building for some time now. I think many of us who've been working on climate for a long time have been slow to see the nexus, and COVID's really accelerated that. And we now have a growing range of case studies that we can use to really implement best practice. I mean, today I heard from Dr. Maria Neira, who you may remember when we launched the Race to Zero, told us to really focus on health. talking about the World Health Organization's recent launch of 6 prescriptions and a long list of actionable ideas for a healthy and green recovery from COVID, which Mark was talking about. And that's been supported by an open letter by over 40 million health professionals. So those same health professionals have been at the front line of dealing with COVID, are calling on G20 leaders to put public health at the center of their recoveries. And of course, we know that the UK is chairing the G7 meetings next year, and Italy, the co-host with the UK of the COP, is hosting the G20. So hopefully there'll be some real climate leadership in both of those. We also heard some amazing examples. We heard from small island developing states. Those of you who've never been to one of these conferences, the small island developing states in Paris were chanting 1.5 to stay alive. These are countries who are literally drowning, literally going underwater as a result of climate change. So they're really ramping up the way they tackle climate change and health simultaneously. And also really exciting to hear some of the very practical initiatives from young people. 2 initiatives from youth organizations who've created their own platforms to engage with the energy sector. We heard about 2 new energy initiatives run by the Global Youth Energy Outlook and Youth Sustainable Energy Hub. And it's great to see that all that energy and that creativity being turned into practical action. Back to you, Gonzalo.
Well, I was also, let's say, quite not only impressed but moved by how much health also intersects with so many other parts of the decarbonization puzzle, including, of course, transport, as we were listening right before, finance and nature-based solutions. And it was great to see partners exploring those interlinkages today. The race to zero definitely is a race towards zero harm. We saw new WHO guidance today, for example, on mainstreaming biodiversity to support healthier and more sustainable diets, and mayors sharing how they are reimagining their cities in a way that improves public health, reduces inequality, and addresses the climate crisis. I was also quite moved by the idea that Kate Rayworth brought. Like, it's so evident that it's not only about zero as a target. Zero is a passing point towards regeneration. So we have 9 days exploring specific pathways. They're not running in isolation. They're running together towards net zero. As Sandrine Dixon declared, and Kate as well said so clearly this morning in the opening session, it's not just about sectors in isolation like the energy sector, but about shifting to a circular economy and creating a just and equitable society. So tomorrow we're looking forward to leaders from the industry, from governments and civil society coming together to mobilize very concrete actions on how to accelerate the net zero industry transition. So with that, thank you everyone for watching, and see you all tomorrow for our next Race to Zero dialogue.